I'm Jasmine Birtles, and today I'm talking to two doctors, or other former doctors, Dr. Ros Jones and Dr. Liz Evans, who are whistleblowers and are trying to help whistleblowers within the NHS. So, Ros Jones is a former paediatrician, and Liz Evans is a former doctor who is also now CEO of UK Medical Freedom Alliance. Hello, ladies.
Hi there. Thanks for having us on.
Oh, great. Well, I'll start with you, Liz. Can you explain to us what you've been doing over the last few weeks, particularly? I mean, I know that you are whistleblowers. You've been trying to raise awareness of the vaccine harms, the problem of the vaccine, but things have hotted up a bit recently in recent weeks.
Yeah, so as you say, we've been whistleblowers since November 2020. We wrote our first open letter before the vaccines were even authorised to say there are serious ethical and safety concerns. Since then, my organisation has written 60 odd open letters, and then we've also been signatories on Ros's letters. And we have written to everybody. We've written to regulators, ministers, royal colleges, GMC, NMC, everyone we can think of. Nobody is listening. And obviously the vaccines are continuing to be rolled out, and the injuries are mounting, but also we are seeing that how censored we have been. Nobody has, we've basically been stonewalled most of the time, and we are seeing doctors who are trying to raise this in their clinical situations being persecuted, threatened, pulled before the GMC. So, as well as being whistleblowers, we have now started to raise the plight of whistleblowers. And we ended up hearing of this Speaking Up scheme, which is actually an NHS scheme that is designed to support whistleblowers. It was sort of formed on the back of a review of I think it was Mid Staffordshire Trust, which had appalling care, and whistleblowers had been silenced. So various schemes have come out of that, and the latest sort of iteration is called Speaking Up. And so we wrote to them because they were asking for applications for people they could support. And we outlined how concerned we were about the fact that anyone raising COVID vaccine safety concerns is being completely stonewalled, or worse, harassed, bullied, and censored for it. And we got a reply from them, and we're not used to getting replies from people. And they offered us a meeting yesterday. So we were really excited actually to have someone who would listen to us. And maybe Ros wants to kind of take over and sort of say a bit
What
more about that.
happened? Yes, what happened, Ros?
Well, it was interesting. They were very welcoming, and it was apparent quite quickly that they've been involved in, looking after whistleblowers over a number of years. So they have got really first-hand experience of the way whistleblowers have generally been treated. And the reason we wrote to them was it seemed so ironic that they were advertising for a support scheme. It's a fantastic scheme. It's offering psychological support for post-traumatic stress disorder. It's offering help with your CV and how to apply for another job. It's really trying to look after the people who've been totally damaged by whistleblowing, but it's not looking at what's going on in the NHS trusts that are treating them like this. And they talked at the end, it was quite interesting, they're in the middle of doing a new annual report, and they talked about looking at cost. And the cost, on their balance sheet, they've got the cost of days lost by these poor whistleblowers being off with stress, etc., and how many £1 million, and maybe even court cases to do with unfair dismissal. But the side of the balance sheet they hadn't thought about at all, as far as I could see, was the loss to patient safety and the health of the nation by the fact that all these whistleblowers get not only trashed and personally injured, therefore, but also silenced with nobody listening to their concerns. And I think that's been our experience with COVID, is that the people who are speaking out are treated as complete pariahs. They're particularly, if you go to a GP medical practitioners tribunal, I've sat in on 2 in the last few months, and it's apparent that the panel just assume that anyone who speaks out is bringing the profession into disrepute. It doesn't even occur to them that what these people are saying could be true, and that it's actually patient harm that they're speaking up about, which we have a duty of within our GMC rules and regulations. We have a duty of candour if we see patients being harmed. So there's this complete sort of double bind, really. If you speak out, you get pilloried by the GMC and everybody else, or the nursing council likewise. But if you don't speak out, you're failing in your duty of care to your patients.
Yeah, and I'd just like to sort of add to that. I think the public should be really concerned about this because it's a massive public safety issue. So as Ros described, there is a whistleblowing system, but it's completely flawed. So I think it's set up to deal with local issues. So maybe if there's an alcoholic surgeon that, a consultant that someone's noticed, that probably is dealt with better than it used to be. But what this system is doing is preventing timely identification of any dangerous drugs or vaccines or interventions, because if it seems that if a whistleblower is highlighting a serious safety issue relating to an official policy of the government or the NHS, they are not being protected or supported, so that the policies are being protected ahead of patients and individual doctors. Everyone's following protocols these days, which we have a big issue with because this is like completely undermining the doctor-patient relationship. And, it seems that these protocols are completely beyond reproach. So they are being enforced. Anyone questioning them is being treated like a heretic. But there's no ownership of those protocols. There's no authors. So there's nobody you can actually have a debate with about whether this is a sensible protocol or a safe protocol, or if there's something wrong with a drug. And so this is, and it also feels like those who are raising the concerns are having to somehow prove that their concerns are founded. But of course, that's not how a sensible system would work, because, you want different people to raise concerns, and you start to see patterns. It shouldn't be that you're punished if your concerns are unfounded, or that the duty of proof is resting on you, the whistleblower.
So it sounds like there's a sort of root and branch change that needs to be made. If we're talking about actual policy that needs to be questioned and criticized, as is happening, and they need to listen. There needs to be a new system whereby, as you say, individual doctors or nurses or midwives or whatever who are going, this whole policy is wrong, that they can be listened to and not be silenced.
Yeah, I mean, we've heard examples of people who are trying to fill out the yellow card system, which has existed right back. It was introduced after thalidomide as a system for you reporting, and they are literally, it was a yellow card in the back of the formulary, which you tore out. Now, of course, it's online, but it's still called yellow card. And people who've been reporting on yellow cards, their colleagues are saying, why are you doing that? And there have been cases we've seen of managers actually admonishing staff for reporting COVID injuries, vaccine injuries on a yellow card. And of course, every new drug has an automatic so-called black triangle, which means any drug that's less than 2 years old, you're meant to report everything, whether you think it's connected or not, so that, as Liz was saying, that the regulators can look for signals. But if you don't report something because you don't know it's linked, well, then how do you find the links? So the whole thing is a circular argument. So that's just one example. And I think also about the protocols, another case in mind is statins. You look at somebody like Malcolm Kendrick and Zoe Harcombe and Asim Malhotra, they were all absolutely trashed in an article in the Daily Mail, I think.
Yeah, it was.
Yes, I might get the right one. The Mail on Sunday, years ago, and told that they were killers. And, the headlines were appalling because they'd said, hang on, I'm not sure these statins are a very good idea. And Malcolm particularly had written a whole book about it. But now they've finally won a court case against the Mail on Sunday for, their character assassination. But it's been a really tough time for them. And one of the things that we wrote, as we've said, we've written repeatedly, we've written to the GMC, and we wrote to them again after Carrie McKeown, who's their current chief exec, she had written after the contaminated blood scandal came out, and saying again, because that's 50, 60 years ago, and still compensation hasn't really been sorted. And it's apparent that from that, people who were whistleblowing on that were being referred to the GMC. And she's very clear that you mustn't have retaliatory referrals, et cetera, to the GMC. And yet she's currently presiding over exactly that for the COVID vaccines. And is it going to take another 60 years before, people like Sam White, David Cartland, who've just been struck off, and a number of people who've been pilloried over this? How long is it going to take before people wake up to the major harms that have happened and retrospectively apologise and get these people back on the register? Well, it'll be much too late.
Well, quite. And you mentioned Sam White and David Cartland. We ran a piece just a few days ago about David Cartland. You, I'm assuming, were at his tribunal, were you?
Yes, I sat in on the whole tribunal, and I was actually going to be a witness for him. But again, I mean, it's the system of justice. They don't. They cancelled all the witnesses. They started by saying 3 out of his 6 witnesses couldn't come, and I was still meant to be one of them. Then they redacted most of the middle of my witness statement, so it sort of had a slightly bland opening sentence and a rather bland closing sentence, and the meat of my statement was redacted out. And in the end, they said he couldn't have any witnesses at all. And his evidence, having sat in on it, it was all showing he put some awful things on Twitter, and he would freely admit that. But the trouble is, they never put what the other people had put first.
Yes.
So we only saw his tweets. It makes him look pretty horrible. But we never saw the context. And the context has been a total and utter onslaught for years now. Death threats, people following him, people taking pictures of, saying they know where his children are at school. Just awful. It led him to the point of brink of suicide, as he's said that on, last year. The tribunal had to be paused for 6 months, and at the end, the total assumption, and I sat in on Sam White's as well, and again, this total assumption by the tribunal that anybody who speaks out must be a conspiracy nutcase, and therefore bringing the profession into disrepute. But it's interesting because when you look at the comments, I mean, Cornwall Live newspaper have been doing some horrible hit pieces. When you look at the comments underneath, all of these, there's so many people saying, you're my hero. It's just so wonderful to see an honest doctor out there.
Yeah.
And okay, they didn't use COVID-19 in their complaint against him very carefully, because I think they realised that the chickens are coming home to roost on COVID-19 vaccine injuries. So they couldn't really use that. So they've gone for Protection Against Harassment Act, for which he's never been prosecuted. So they've used a criminal example of a criminal case, and yet they haven't actually criminally prosecuted him for anything.
Yeah, I mean, sorry, I was just going to say, it feels like, the individual ethical doctor who wants to do the right thing by their patients is up against this incredibly powerful system, with huge vested interests, with huge amounts of money. The minute you question a policy, like with Dave, it's interesting that they couldn't take him to the GMC for questioning vaccines, but they have set him up to destroy him. He has become the scapegoat, and he's the example. So no other doctor, in their right mind is gonna go against the system when they see what happens to, how people's lives are not, they're not just quietly sacked, they are destroyed publicly. This is a witch hunt. And I think it's only the most extraordinary doctors of immense courage and integrity and self-sacrifice that will go through that, and it breaks them.
You remember back in 2008 when we had the big financial crash, we found that the regulator was pretty much in bed with the banks. And it sounds, to be honest, like it's something similar here. We've got pharmaceutical companies in bed with the regulator. Is that a fair assessment, or am I going a bit too far there?
I think 100%. That's very fair, 100%, yes.
Yeah, I mean, we can see from the funding and the revolving door. I mean, the MHRA is 84% funded by pharma. GMC, I'm sure that there are funding issues, and also just it's political. This has all become political now, I think, and there's an ideology that they are seeking to protect. And individuals cannot speak the truth against that because they will be destroyed. And I think so this whistleblowing scheme that they've got is just a sticking plaster. It's very much like they're treating the symptoms, but not the cause. And they need to be given some teeth so that someone who wants to whistleblow goes straight to the whistleblowing service. They are anonymized, because what's interesting in Dave's case is that all the people who were speaking against him were allowed their anonymity in the press, and yet he wasn't. So it feels like you need the whistleblower to be anonymized, and all the information should be, there should be some sort of rule that it has to be investigated properly, that there can be no link with the whistleblower, and that there are sanctions, and there should be a sanctioning authority that actually deals very swiftly and brutally with anyone who is bullying. Because, you know, these sort of chief execs or, you know, people in leadership positions of leadership who are threatening people or giving them, you know, vexatious GMC referrals, you know, that's a massive power to have over somebody's whole life, their salary, their career, everything that they, you know, do. It just rests on one vexatious GMC referral, and the GMC are so willing to, you know, sort of play their part in silencing whistleblowers. So it feels like there needs to be a complete overhaul so that the whistleblower is given the power, and anyone who stands against that is the one who gets referred to the GMC.
This sounds like it's something that needs to be done at a political level, at a government level. I mean, is Wes Streeting interested in any of this?
I think he just might be. I mean, you know, he's been listening more to some of those things than previous health secretaries, I have to say. I'm like, you know, I'm not saying I hold out a lot of hope, but, you know, for example, he was prepared to speak out against assisted dying very clearly, and against the changes to the Abortion Act, I think. And that's quite brave coming from the minister. I mean, I know it wasn't a government bill, it was a private member's bill, but still, you know, I think that takes some nerve, and I think if anybody can change it, maybe he can, but who knows?
And question, I'm just thinking about what's happening in America, because we've got a few states now that are rejecting the COVID vaccine. Is that having an effect over here? Surely people are hearing about it. I would say people in authority are hearing about it.
Yeah, I mean, what's interesting is the NHS workers themselves, only about 15% are now accepting the jabs. That, you know, they're all entitled to it because they're, you know, in their at-risk group or whatever. So 85% or so of them are rejecting it. Now, that surely, why are they rejecting it if they've got, you know, this amazing access to this incredible product? And I think, you know, people are voting with their feet, but those 85% of NHS workers are still recommending and giving it to patients, which is just morally and ethically so wrong and so bankrupt.
Yes, and I'm guessing that later on, if finally it is acknowledged, say, as with thalidomide, as with the blood scandal, finally it is acknowledged, then it's going to be the doctors and nurses who will be blamed, I'm assuming.
Yes,
probably. Yeah. Yeah, there's nothing new under the sun. These things we never really learn from our mistakes, do we? You know, you have all these amazing reviews with all these great sort of, you know, plans and statements and pledges for the future. But human nature is the problem here.
So, Liz, is there anything that individuals can do to support your work and to do something just in their own, if you like, small way? You know, is there something that each individual could do to help?
I mean, certainly do follow us. We're on our website's ukmedfreedom.org. Sign up to our newsletters because we put out calls to action on medical ethics issues. We also do a Substack at UKMFA1. Donate, because we're all working for free, but, you know, it still costs money just to run all these platforms. And I think also what we're trying to do is empower patients with the knowledge of what an ethical consultation looks like with your doctor, and what red flags are, and what informed consent is, and what your rights are. Your right to say no to any treatment without any coercion. And I think we almost need patients to start demanding ethical consultations from their doctors, because I think, you know, we are lobbying, you know, the decision makers, the policy makers, but that's falling on deaf ears. So I think we've got to get people empowered to start demanding informed consent and proper medical ethics, and to know what their rights are and to be, empowered to say no.
And Ros, what do you think when it comes to actual patients and their interaction, not just with their doctor, but with the NHS generally?
Yeah, I mean, I agree with what Liz said. I think our strongest success has been empowering patients and parents, particularly in my situation. If you look at the COVID vaccines, Liz mentioned 15% of the NHS staff still taking them. And when it came to rolling them out to primary schools, for example, it was less than 10%. So 90% of parents actually said, no, this isn't right. Yeah, I've ended up doing quite a lot of medical legal work for where there has been parental, marital breakdown. The COVID vaccination has been used as a weapon, with one parent saying, oh, they must get the vaccine. And whoever I've done a witness statement for, the judge has always, the latest one I've done, so perhaps that's good, but they always find for whichever parent, it doesn't matter whether it's the mother or the father, the resident or the non-resident, it's the parent who wants what the government's recommending wins the day. And that means, in effect, as I keep trying to say to these judges, it's the parent who's asking for this who's actually the outlier, not the parent who's saying no, because 90% of parents use their gut instinct to say, A, COVID's not a serious disease for children, and B, this vaccine is clearly totally new and hasn't got long-term safety data, and, I don't want it. So I think parents just need to go with their gut instincts about most things. If you go to hospital and they don't believe you, I mean, it's one of the basic things we was always teaching, you need to listen to the patient, or in the case of a child, you need to listen to their parents. The parents need to have the courage to speak up and ask difficult questions. Ask why all the time.
Yeah,
like well, annoying toddler just keeps saying why.
Why and no.
Yes, it makes you behave like a toddler, but that's the best safety for your toddler is for the parent to behave a bit like a toddler.
Excellent.
Tap your foot.
Well, thank you so much, Ros Jones and Liz Evans. So Liz, you're from the UK Medical UK Medical Freedom Alliance. And so do have a look at their Substack, have a look at their website, do follow them. I'm guessing you're on Twitter.
Yeah, at UKMFA1.
Right.
And likewise, Heart Group is heartgroup.org.
Of course, I didn't mention the Heart Group. So that's HART, Heart Group. They're a very important one to follow as well. And do your bit, complain, say why, say no, ask why, say no. And then you can be part of the changing of policy. And it sounds to me also that it's worth writing to your MP about it. If more people write to their MPs, then maybe policy will be changed at the top, which is basically where it needs to be done. So thank you, both of you, Liz and Ros. Thank you very much for coming on. Do like, share, tell all your friends.